So we're live. Sorry, hope I didn't get anyone dizzy doing that. Let's go live here as well. All right, we are going to be live on, let's see, Instagram, TikTok, and YouTube. I think we're already there for anybody joining. Happy Tuesday. Let's give everyone a second or two to come on in. Excited to be here with you guys on this Tuesday. I remember a time where I used to do Tuesday lives all the time, and I don't know why I got away from that. But we're gonna dive in. We have lots to talk about. I was just doing a live with Will Cole, and he got a ton of questions on his feed. It was so much fun being with him and talking with him about all things hormones and the hormone shift. Who has their copy? Who already has a copy? You guys can give me a wave. I am so curious to know what you guys think. It's been about 2 weeks that it's been walking around in the world. I'm getting a lot of comments and DMs and feedback on it, questions as well. Then I promise I'm trying to tackle them as they come in. I just love the fact that you guys are so excited about this topic. And I love the fact that everyone's diving into it and really resonating with the whole idea that there are 5 hormone shifts and they're all connected up together. So thank you for taking the time out to read it, to digest the information, to ask questions, to ask about the plan. I think this is all great. And I know a lot of you get information from lots of different places, but please understand that my motivation is really to bring us together and really have sort of this east-west approach to balancing hormones, women's health, because we just get such an incredible expanded toolbox when we do so. So feel free to use the button below, ask questions. We'll tackle what we can. We have about 20-25 minutes together. As you're thinking through your questions, then maybe even let me know where you are. I think one of the things that, and I'm still playing catch up, guys, by the way, so I apologize if I haven't gotten back to you, but one of the things a lot of you are asking me, you're in, London or Spain or in different parts of the world, and you're wanting to know how to check your hormones and what to do. We are putting our team on it and trying to help you figure that part out. So I think Kate might be out there for you. So we are trying to figure that part out for you, but bear with us as we try to understand who our partner labs are going to be around the world. But in the interim, you can order labs. You can do like the saliva testing or the urine testing off our practice website or my website as well. Because remember, as long as you do something, we have an idea of what's going on with you. So whether it's a saliva test, whether it is a urine test, regardless of what the test is, please just do something so that we have a way to track and to be able to tell what's going on with you. And let's talk about the plan for just a second. The plan is a universal plan. So the plan in the book is a 30-day plan. It's a universal plan really meant for all of you, not just if you're in perimenopause and menopause, because again, remember, we are really dealing with that east-west sort of idea around hormone balancing. And so that applies to folks that have PCOS, people that are trying to get pregnant, teenagers. Everyone can do the plan. And the plan takes a cycle, and by that third week, it sort of not bifurcates, it actually goes in 3 different directions, because it tries to help you identify what your hormone type is, and then it customizes the plan a little bit further. So I'm getting a lot of questions about the plan. Who is it for? It's for everyone. If you can get your teenagers to do it, I am all for it. I really would love for that to happen, because the earlier we get our young girls in this conversation, the better we're making their overall health journey down the road. So that's what we're thinking with the hormone shift. And I want to know what you guys think. Maybe add some comments in. Does everyone have a copy of the book? Maybe wave at me if you've got a copy of the book. And if you have the book and you love the book, please, if I can beg you to go and post a review on Amazon, because that allows more people to find the book and in turn pass it on to other people they know. And if you send me a screenshot of it, of your review, remember, like all reviews, we will send you a free bottle of Boost. All right, I'm getting a lot of questions coming in. Before I start taking questions, I've got to say something about world events. Again, I don't want to be overly vocal because I know it's a sensitive topic, but I just want you to know, no matter what you're dealing with or wrestling with, I hope and pray that you are okay. And I want to encourage you guys. One of the things I even talk about in the book, by the way, is the toll of trauma and grief on the nervous system, and how in the Chinese medical model, it kind of lives, right? It lives in the gut. And then anger, if you're feeling a lot of anger, I actually had a patient yesterday. This is not, I'm not lying at all. This is a woman who had a lot of anger about everything happening. Sure enough, it showed up in our scans that we do. We do some vibrational, emotional energy scans, that type of thing. And it showed up. And the Chinese medicine concept, the Ayurvedic medicine concepts, Eastern medicine concepts of medicine are when our emotional equilibrium is thrown off, it will show up in our physical body if we don't do the work to reset it. So please keep all of that in mind as you navigate whatever's happening out there. And kind of my rule of thumb in these situations is to over baby and over nurture yourself. That means schedule that massage, get outside, be with people you love, pray, do acupuncture, yoga, whatever it is, but just schedule it and do it, because you first have to take care of whatever's happening here before you can really give to the world. So, okay, having said that, let's take questions because there are questions coming in. Let's see, I've got this one. Okay, questions. Why does, oh, I love this one. I don't know if these questions are showing up. There's a way to do that. I don't 100% know how to do that. Let's see if we can do that. Nope. Do you want to call them out?
Yeah.
Maybe we'll do that. We'll go to our old way. There's a way to pop them up and let them show. We're trying to figure that out. But anyhow, we'll tackle some of them.
Can you talk us through the perimenopause symptoms?
Perimenopause symptoms. So that's the question I'm getting. So they are very varied, and there's a long list, but I'll talk about my top 5. So my top 5 perimenopause symptoms that I see in practices at Center Spring MD include a change in energy, a change in weight, a change in sleep, right? So you're waking up a lot throughout the night. A change in your periods, right? They go from fairly regular to now they're super heavy, or they're super light, or they're really spaced out, or they're too frequent. Those are all signs and symptoms. And then last but certainly not least, you can see a change in libido. So those are some of the more common perimenopause and menopause symptoms that I see.
Okay, and then we have someone asking, I think I'm going to mispronounce this, early teen PCOS and
Yes.
Hashimoto's,
Mm-hmm.
now hyperinsulinemia.
Oh yeah.
Diagnosis, should she start metformin on top of Synthroid?
Okay, so I heard a teenager, and a lot of us have teenagers like this, by the way, now, because PCOS is becoming a massive epidemic. It was a big part of my story, went undiagnosed for a long period of time. I'm seeing my daughter as well. So what I heard, please correct me if I missed anything. Lily's back here. She's always off camera, but she's back there, by the way, if you want to say hi to her. But what I heard was PCOS now has hyperinsulinemia, which is high blood sugar. Anything else?
Hashimoto's and PCOS.
Hashimoto's too. Okay, those are all connected. They're all connected in the gut. Usually the connector is yeast or candida or having a gluten intolerance. By healing the gut, you will lower the androgen load of the PCOS and the inflammation of the Hashimoto's. For teenagers, as a band-aid, sometimes they do need to go on medications, right? Especially if they can't follow through with some of that. But there are a lot of natural remedies that work too, like berberine and saw palmetto, to bring the androgens down and to bring the insulin resistance in balance. If you don't want to go that route, then yes, it's metformin, something to manage the thyroid. But what that plan does not do is get into the root of inflammation and gut health and some of these patterns that we need to dig into. Okay, so just keep that in mind. All right.
Okay. Can diet changes help regulate insulin?
Can diet help regulate insulin? Absolutely. In fact, so much so that we've been handing out and prescribing those glucometers, right? Anyone, I don't know if any of you have done a glucometer, the continuous glucose monitor. There's a Freestyle Libre that goes directly in the arm, or there's the Dexcom that you wear, and you can kind of track what your blood sugars are doing in response to different foods. Some people will randomly find a healthy food, something that we all think of as positive, right, or a good food with lots of great nutrients, is actually spiking their blood sugar. So that's where some of that information is really helpful. The things we know for sure, we've talked about, right, 1,000 times. We know alcohol sends blood sugar up and then sends it way back down. So we see a lot of reactive hypoglycemia with alcohol and alcohol consumption. We see a lot of issues with sugar, right? So processed sugar, refined sugar, foods with dyes, all of those type of things seem to send blood sugar up and down. That's why we always advocate for cleaner foods or whole foods. And then depending on who you are, we may or may not see glucose intolerances or glucose irregularity with things like gluten. That's my story. So if I eat gluten, there's a whole bebopping of blood sugar all over the place. Or, corn is another big one. Soy can be one for many people as well. But if you're trying to think in order of what do I tackle first, what do I do second, I think first is always taking out the big bad guys, right? The alcohol and the sugar, processed foods, dyes, packaged foods, fast foods, then moving into like, are there healthier foods that may be problematic for you?
Okay, and my doctor finally agreed to do labs. Estradiol is less than 5.
Okay.
Didn't test progesterone. We'll ask for bioidentical HRT next. Is it okay to start estrogen and progesterone without having labs for progesterone?
You can always start things and go by your symptoms. I don't love that though, to be 100% honest, because then we don't know if you're not super intuitive with how you're doing, then we're kind of playing a guessing game, which is not my favorite. So obviously your estrogen is low. You'd probably benefit from some estrogen. The follow-up question would be someone needs to monitor what your body does with that estrogen. Where again, there's lots of information in the book about labs and what to check and all that other stuff. So, check not just an estradiol, but an estrone and some of those numbers. If you start progesterone, I would start it in a really low dose. If you get breast tenderness or a lot of bloating with that progesterone, that dose is often too high. Or if you feel foggy, out of it, that type of thing, that dose is a little bit too high as well. So those are your signs that it's too much. Ideally, these are easy to test. Just get them tested. You can do labs through LabCorp Request. You can do a saliva test. There's so many testing options available. We have them on our websites. You can be a patient and do it with us. I mean, there are just so many ways to get your hormones tested now that this should not be as hard, I think, as many people are saying or making it out when it comes to the medical community, right? This should be very, very easy to do. All right.
I think we have 2 more.
Okay, awesome.
Do you suggest staying away from safflower, sunflower, and grapeseed oils?
Okay, I just posted a video on this today on Instagram. I don't know if you guys saw it. This is about seed oil, safflower, sunflower, and grapeseed. I don't think you need to stay away from them. I think we use those oils if you are frying, cooking at high heat, and you use a small amount. The problem is where we're reusing these oils over and over again, we're not varying and rotating oils, then we get too much. We're getting too much omega-6, and you always want to use fresh oil, right? Never reuse the same pan of oil or the same vat of oil. That's what, I talked about it today a little bit. That's what a lot of fast food restaurants do, and that actually is highly, highly inflammatory. Safflower, sunflower, grapeseed, high in vitamin E, right? High in linoleic acid, really healthy in some ways, but excessively, it's a problem, right? So that's why people have put them all in the bad category. They don't really belong in the bad category. They belong in, hey, let's use it for certain purposes and move on from there.
Okay, last question. How do we know if we have insulin resistance? I've had blood work done and glucose was good while fasting along with adrenals.
Okay, so insulin resistance, model, they're looking for diabetes. They're looking for an A1C that's usually over 5.6, 5.7 or so. Insulin resistance and R is your blood sugar being very reactive, going from high to low, or staying as a continuum over about 90 or so. Ideal blood sugars, day to day, moment to moment, should be somewhere between about 60 and 80. Maybe some people need to go up to 90. When they're going much higher than that, then we know they're either eating in a way that's not conducive to their blood sugar, or they have some level of insulin resistance that is developing. I think belly fat is a sign of insulin resistance, but in addition to that, you can check leptin levels should be 20 or under. When leptin gets too high, then we know these are early signs of insulin resistance. You can check a C-peptide fasting. If that number is too high, those are early signs. And fructosamine is another one that you can check and keep an eye on. If that's too high, then we know, again, you're at risk for insulin resistance.
We have one final question.
Okay, one more. Awesome.
Okay. Should you get HRT to prevent dementia and osteoporosis, early menopause at age 43, really low estrogen and progesterone?
Yes and yes, as long as you are, so the question, let me re-ask the question. Question was, should you get HRT to prevent early dementia and osteoporosis? Absolutely, as long as your body is able to metabolize those hormones effectively. Meaning, you got to get these hormone levels checked. Check estrogen, check metabolites of progesterone. What is your body doing with the hormones? And for all of you guys on hormone replacement therapy, you should be doing your breast scans, right? Your mammograms now need to become yearly or every 2 years. You can do a yearly thermogram that looks for inflammation and tries to pick up excessive activity. When it comes to hormone replacement therapy, if you still have your uterus and you're doing HRT, you need to be doing a pelvic ultrasound. It shocks me that we don't automatically do that for women, because it'll show us what your uterine lining's doing, what is happening with the ovaries. Because again, we don't want to assume, because you're not making your own hormones, everything's fine, or because we're giving you a hormone, everything's fine, right? Or even for all of you that are younger and have hormones, you should be checking this stuff. We need to understand what's happening. Labs are helpful and great, but imaging is equally important too. I saw some lively banter, is what I'll call it, about the fact that my practice offers thermograms. Here's why we offer thermograms, guys. We're looking for inflammation. We're looking for a visual image of the body having an issue. We're not saying do thermograms and then don't go do all this other type of imaging. We're saying this is an adjunctive way, in addition to lab work, to help us understand what's going on with the body. So, I didn't respond to it because it was a bunch of useless trolling that wasn't worthy of a response. But again, please understand the context from which we make these recommendations. So these are ways you advocate for yourself, and you stay on top of what's happening, even as you're adding modalities and going through these different hormone shifts, for sure. Okay, I think I saw one more in a previous post that I didn't get to and didn't answer you, and I don't know if you're on the live today, but it was about pellet therapy, and someone wanted to know why I hated pellet therapy. I hate pellet therapy. The reason I hate pellet therapy is because it drives your hormones up. It gives you a heavy-handed dose of hormones, and you have no control once you receive that. Like, how you're metabolizing them, how you're detoxing them, that's now out of your hands. So it drives these hormone levels up. You feel amazing. You feel fantastic because you finally have hormones, but then it brings them down. Meanwhile, you're storing, and a year out, we're dealing with the storage of all these high doses of hormones and having to deal with that. That's why I don't like pellet therapy. All right, I think hopefully this was helpful. Hopefully we got to most of your questions. I'm seeing some comments on here about, where do I find all this? I have written The Hormone Shift. It's been out for about 2 weeks. I encourage you guys all to pick up a copy. It's sold everywhere books are sold. Pass it on to your loved ones, a woman younger or older than you. We all need this information. And please go get your hormones checked. I think that is incredibly important. Now, for those of you who haven't already joined, remember you can join my community. We meet monthly. I usually talk and lecture about a particular issue. Next week, we're going to be talking about adrenal fatigue and what it means for the hormone pathways. And we bring on a guest to help us either with food or exercise or mindfulness, and really trying to learn a new toolbox or tool sets. You get great discounts on everything in my world and invitations to events as well. So check out the community. We call it the Superwoman Circle. It's on my website. You can go to drtaz.com/superwoman. And everyone in Atlanta, who's in Atlanta? For all of you in Atlanta, join me tonight. I'll be at Eagle Eye Books out in Decatur, signing books, taking questions, and I just look forward to meeting all of you guys. So hopefully I'll see you there. And until then, next time we'll probably be doing lives Tuesdays or Fridays, but of course we'll let our community know so that you guys can join us. All right, have a great rest of your week. Don't get stressed, please. No getting stressed, no getting upset. I'll see you guys soon. Take care.